Hi everyone and welcome to ATP Live Monday. Just trying to see whether I can make my camera brighter. All right, I hope you've had a good day. Okay, welcome to ATP Live. This is a program where you get to ask any questions that you may have about the health of your children, and we'll try and answer them in the next 1 hour. So welcome. Try and share the link of the video to everyone. I'll also do the same as well. So for the next 5 minutes or so before we start to answer the question, we should just share the link to the video so that everybody can see and everybody can hear. And if you have any questions, you can start to drop your questions now. All right. Okay. So I'm also going to do the same, just sharing and pinning, making sure everybody can hear and everybody can see. Let me just okay. So welcome. Those on Instagram, those on Facebook. You're welcome to ATP Live Monday. This is a program where you get to ask any questions that you may have about the health of your children, and you get to an answer live and direct from a pediatrician. We have just an hour to do that. So if you have any question, you can start to ask your question while I am doing the sharing to our groups so that people can see and they can hear. And then we will start to answer the question later. So I just want to quickly share all the video to share the video to all the groups so that people can hear and they can ask their questions. All right. We're in the last quarter of the year. I hope it has been a good year already. So we're rounding up gradually. No matter what, though, there's still a time in the year for all of us to prayerfully achieve our goals. Okay, so I guess I'm done with the sharing to the groups. All right, so welcome everyone, whichever platform you're watching on Facebook, on Instagram, on YouTube, whichever platform you are. I just want to say thank you so much for joining me this evening. I am Gbemisola Boyede. I am a pediatrician. I am also the CEO of Ask the Pediatricians Foundation. And our mission on Ask the Pediatrician Foundation is to provide you with support to raise your children in a healthy fashion. We do have a mission of making sure that no child dies. It's a vision, right? No child dying from preventable causes. And we do that through our health education platform, online and offline. We also do free community medical outreaches in communities that are indigent and also in our schools. We have been doing a lot of first aid care campaign in the last year. So thank you so much for joining me today. All right, I guess I'm almost done with all my pinning and all the admin parts. So if you have any question, feel free to post your question on our Facebook group. I mean, sorry, feel free to post your question on the platform you're watching on, whether on Instagram, on Facebook, or on the YouTube channel. For those who are watching in the groups, you may have to post your you may have to click on the video so that you can post your questions and I'll be able to see them. All right. So let's start the questions coming in. I can't see any questions yet. So let's start to ask any questions that we may have. Please, when you want to start asking your questions, start with the age of the child. It's very important for us in pediatrics to know the age of the child because the answer we give may vary depending on the age of the child. So please start with the age of the child and then try and go straight to the concerns that you have, try and keep it simple and short, but give us relevant information. If, for example, you're asking about weight, it would be nice to tell us what the birth weight is, what the current weight is, then we can take it off from there. For things like rashes, we may not be able to do that because you need to post a picture. So for such things, you will have to post it on our Facebook group itself. So of course, we just have 1 hour to answer your questions on the live session. If you have any questions after the live session is over, oh, Major Evans, welcome. Thank you for joining us. You're always there on Instagram. So if you have any question after the live session is over, feel free to post on our Facebook group. I'm sure you all know we have about 4 Facebook groups actually. The main one, which most of us are familiar with, is our Ask the Pediatrician Facebook group. That is the mother group. That's the group where we answer questions about the health of children. But we also have some other groups like ATP Family, where adults can ask their own questions. And we also have the FTM, First Time Moms group, and as well as the ATP Still a Mom, which is a support group for those who are going through um, who have suffered maybe the loss of pregnancy or bereavement of a child, so we can provide you some support around that. So those are the groups we have. So if you are late or you are watching a repeat broadcast or a recorded broadcast, and so which means you can ask your question live, when you finish watching, please go to our Facebook group and you can post your questions there. But we are live now, so this is between 6 to 7 West African time. You are welcome to ask a question now. And I think I have a question already on Instagram from Major Hevers. Okay, you have a question about your son of 9 weeks, birth weight of 3.4, weight of 6 weeks of 4.9. Yeah, my son doesn't like sleeping on his back. Oh, he prefer tummy sleep and I'm scared. Okay, so you have sometimes there's not, children don't come with any preference of this is what I like, this is what we introduce to them that now help them to pick one. So somebody definitely put the child on the tummy. That is why you are not able to say, well, the child doesn't like to sleep on the back, you like it to sleep on the tummy. So please put the child on the back. That is what we recommend. And your 9 weeks old baby cannot even roll. So your 9 weeks old baby will stay on their back if you put them on their back. And as long as you keep doing that, then the child gets used to it and the child will sleep on the back. So there are reasons why we recommend. So these are recommendations based on research. So by now the difference between ATP and any other groups where people give you answers to questions on health issues of children is about the evidence. So we don't just give you recommendation because that is what I like or that's what is popular. No, it's about, there are scientific basis for every single recommendation we make. And so there have been a lot of research on way for babies to sleep and all that. And the consensus is that babies should sleep on their back. So because we don't want babies to, we found out that babies who die from what we call sudden infant death syndrome, SIDS, mostly related to sleeping on the face down. Because when baby sleep face down, you can easily block their nose, block their mouth, and babies can easily go away with like that. And also when you have too much free stuff on the bed, those things can also block airway and all that. So children are very, very obligate nasal breather. Nothing must block the nose and all that. So they have to sleep on the back to reduce. So I think the risk is not what the little whatever you think is comfort from baby lying on the tummy. No, the risk is too much. So we don't want that. So keep putting the baby back on the back, and after a while they will get used to it. So please, just there's nothing to do, just put the baby on the back. Once they are sleeping, they must be on the back. When they are awake, they can do tummy time, because then they can lift their head and all that. But once they are sleeping, they must sleep on the back. Yeah, the baby will sleep, because there are many ways you can get your baby to sleep. You can carry the baby, you can cuddle the baby. Then when the baby is sleeping, you put the baby on the back and let them get used to sleeping on the back. After a while, then you begin to fall. There are many reasons why babies struggle to sleep at this age. This is the age where they are prone to having colic and all that. It's not necessarily because the baby lying down on the back. It is just that is that period, and at that time of the night, sometimes babies are struggling to sleep. But once they are asleep, you must always put them on the back. So the baby crying does not cause any headache or anything. So that is just that. So sudden infant death syndrome is not something we want any baby to have, but it's something that can happen. So please always put the baby on the back to sleep. All right, Facebook. I can't see any question on Facebook. If you have questions, please ask your question now. Yeah. So just then another thing is why we're still on this issue of sleep is that you must also allow babies to learn to fall asleep on their own in the bed. Some of us we struggle with that part. It takes time for babies to develop that pattern and routine, but we need to let babies get used to the fact that they can sleep on their own and in the bed, and they can fall asleep on the bed. It doesn't mean so. Sometimes some people use all this kind of cots that you can, dangle a little bit, rock the children a little bit. So just to make them comfortable until they fall asleep on their own. But it's just trust me, it's a passing phase. After a while, the babies will sleep on their own and they won't be crying. Even if they have colic, most of them by the time about 3 to 4 months, that should resolve. So it is not a big deal. So baby should sleep on the back, and more importantly, we should make sure that the bed is firm. So we should use all these fitted sheets for the baby's mattress. And please don't put all these things we put on. I see a lot of people baby's bed, people post online, they're putting the teddy bear, they're putting the pillow, they are putting these toys here and there. All those things are unnecessary and they are very dangerous. And babies do not need any of them. They don't even need all those your blanket that you put over them unless the weather is really cold. So what we want in the bed is just the bed and the sheets covering it, and the sheet should be a tight one, those fitted one that so there won't be any losing, any loose end for the baby to roll. Some babies strangle themselves without some of those sheets. So please, everything should be firm and nothing else. Babies don't need pillows as well. So no pillow for babies, and they don't need all those teddy bears. They don't need all those cuddly toys in the bed. Okay, always remove it. Just leave it, and just wear the babies their normal onesies and all that covers them, and then they won't need all those extra blankets on top of them. And if at all you want to put that, make sure they are the knitted ones that have holes in them, so that if at all the baby cover their faces with them, there will be holes through for the baby to breathe. These are things that can be very important, and we don't want babies, passing because of us. So please, let's take this precaution. Princess Sharon, you're welcome. Please ask your question. If you have any question, you just ask. You don't need any permission. Just drop the question and I will try and answer them as soon as I can. So go ahead and ask your questions. If you're just joining us, welcome, welcome. So those of you who are just joining, welcome to ATP Live. Yeah, okay, Major Evans, you're welcome. Please ask your questions. Start with the age of the child. Tell us what your concerns are, and then we will try and answer them. All right. So I hope that's helpful. Whether you are asking on Facebook, on Instagram, or YouTube, just drop it in the comment section under the video you are watching on. If you're asking in our Facebook groups, please remember that you may have to click on the video so that you can be brought to the to the Facebook page. Where is the link coming from? And then you can put your questions under the comments. All right. Okay, so we have a question on Facebook by Bukola Fanny. What? Good evening. My 1-year-old has catarrh and cough. What can I do to relieve it? Birth weight is 2.65. Current weight is unknown. So most cough and catarrh in children are caused by viruses. So viruses are germs, but they don't usually require any specific medication. So usually the kind of cough and catarrh they have, that is just like runny nose and cough, but there will be no fever, there will be no uh, difficulty with breathing and all that. So if it is that, most time we just say wait for it. It will run its course and it will go away. Keep your child warm. Nothing to do. But if the child is having fever, he's having fast breathing or difficulties with breathing, that may be a sign of pneumonia. Usually, pneumonia are due to bacteria, and those often will require antibiotics. And for those cases, you have to take the child to the hospital. So most children who have cough and catarrh, most of the time, maybe they pick it up from other people having cough and catarrh. Most of the time, they are viral, and then they will resolve on their own. You don't need to do anything. But if there is fever, fast breathing, difficulty with breathing, that's when you need to go to the hospital, because that's when the child will need antibiotics. So that's all. I hope it's helpful. Princess Sharon, you have a very long question. I would like to know more about newborn jaundice. Okay, what would you like to know about newborn jaundice? I gave birth to her 12th of October through elective CS. Maybe weight 3.3. On the third day, you notice the height was yellow. Took her to PED. Total bilirubin was 7.3. Okay, while direct was 1.4. Yeah, she was placed on phototherapy. There was actually no need to put your child on phototherapy for the SB level of 7 on the third day of life, because that is still what we call physiological jaundice. That is normal jaundice and doesn't require any treatment. And there was no need for the antibiotics as well. So I felt your doctors was over treating your baby. Okay, because your question was too long, I can't see the rest of it. So it ended with and we were. So you have to tell us whatever you wrote after we were. So just feel free to post the rest, because if your comment is too long, Facebook is going to cut it off, or StreamYard. I don't know which of them now. So, but the part we can see, I hope you are still with us. The part I can see is the part on the screen. So anything after that, I can't see it on the screen. So we've lost you at some point. So you have to. Anyway, so I've gotten your point. So what is the issue now with the jaundice? Well, the jaundice we initially talked about is physiological jaundice. Your baby did not require any treatment for that level of jaundice. That baby should just have been washed and the jaundice level monitored. But we didn't see the rest of your questions. So you have to start from where you stopped on. Your baby was given antibiotics on 8-hour interval. Whatever comes after that, I can't see it on my screen. All right, Tijani Bolanle say my babies snore a lot. Um, snore? Is it snoring? I hope is it snoring you want to write, because I know it will be a typographical error. You've taken it to the hospital, but it says snore. So when you went to the hospital, what were you told is causing the snoring, Tijani, and then what treatment was given to the baby? So it's not enough for you to tell me you've gone to the hospital. I need to know what happened at the hospital. So what were you told is causing the snoring, and what treatment was your child given? Then I will now know how to take it up from there. So feel free to repost, and I hope you are still with us. Okay, somebody's asking on Instagram. Good evening, Doc. Thank you for all you do. God bless you greatly. Amen. Thank you, Laurie. Mal. My 5 year old pool is always too big and large in quantity. I feel he's pulling everything he eats. Okay, birth weight is 2.4. Current weight is 18.5. So your baby's number one weight is okay. It's actually over the top. Usually, average 4 year old should weigh 16 kilos. So your baby's already weighing that of like a 5.5 year old or thereabouts. So the baby is not passing what the child is eating. That is not true, because if that is the case, then your child will not be gaining weight, and your child's weight is actually upper limits of normal, if we put it that way. That's number one. Number two, I want to know how frequently is your child passing stool? Is it watery? Is he, I guess it's not watery because you say it's large. But I want to know, when you mean it's too big, what do you mean by big? Is it hard? Is it normal texture? Because that is what is important to us. Let me quickly see whether I can show you the stool charts. And if you can tell me what stool number your child is. So this is what we call the Bristol stool chart. Let me remove that comment so that people can say it. So this is the Bristol stool chart. So just quickly have a look at it, and let me know which number your child is. Is it type 1, type 2, type 3, type 4, type 5, type 6, type 7? I hope it's clear enough for you on Instagram to see, because that's what will determine the answer that I give you. So if your baby is passing hard stool and it's not passing it every day, then that will be what will qualify as constipation. Usually that's between type 1 to 3 hard stools, and the child is straining and the child does not pass even the stool every day. That will be constipation. And what you need to do is to make sure you're giving the child lots of water, fruits and veggies. But if the child is passing any stool from like type 4, which is a normal stool, is sausage like or snake like, is smooth, it's not hard, the child is passing it every day, every other day, that is normal. And the quantity the child passes is irrelevant, as long as it is normal texture stool, it's not hard, and the child is not having any form of pain. So Loretta Mal, if you are still there, I hope you're able to respond to that so I can give you further advice about that. So but I'm going to remove the stool chat now so like other people can see their comments. All right, so but if you want to answer, I will respond to you. Okay, and let's move on. So I'm Tommy. So Tijani Bolanle, I'm still waiting for your updates, as well as the person asking about jaundice, and as well as Loretta Mal, that's Princess Sharon. So those three of you, I will still wait for your updates. All right, Sammy Peterside. Good evening, Doug. Is it normal for baby that is fast asleep to start crying while asleep? It's not. There's nothing abnormal about it. It's something that can happen. So when babies sleep, they dream. Okay, they go through what we call REM sleep, rapid eye movement sleep, and they also go through what we call non-rapid eye movement sleep. So during the rapid eye movement sleep stage, it's like babies are reliving what has happened during the day. They kind of dream of what they've done during the day. So if the child has slept during the day, and the child has cried, sorry, if the child has cried during the day, then the child can cry at night when they are sleeping, because they are actually living again the experience they have done. It doesn't mean that a witch or something is terrorizing the child. Okay, so there's no reason for you to worry or to start panicking, and the child is not being attacked. So the child is just reliving the events that has happened during the day. If it's for like example toddlers, they can actually talk, and you see them talking about what they've done during the day as well. All those are normal behavior, and it's nothing to worry about. All right, so Miash Milaya, thank you so much for joining us. Thank you for your word of encouragement. Um, okay, type 3. Type 3 sound like a little bit hard. We usually want this to be type 4. So if your baby is having type 3, you need to increase the water content, you need to increase the fruits fiber, food that has a lot of fiber in them. You need to increase it for the child. Please try and take away too much of junk food. No, all these pastries, biscuits, all those things, you need to take them off. Let the child eat more fruits and vegetables, drink loads of water, and that should be fine. All right, but at least the child is passing school every day. That is also good, so nothing to worry about. All right. Chijoke Obioma is saying, what causes abdominal swelling in children? That's a very big question, okay, because there are many reasons why tummy could be swollen in children and even in adults anyway. So inside your tummy, you have so many organs. So we have the liver, we have the kidneys, we have the pancreas, we have the spleen, you have the intestine, you have all those organs. You have the adrenal glands, so many organs inside the abdomen. So if any of them is swollen, the tummy can be swollen. Okay, so that's number one. Number two, it may not be the organs swollen. Sometimes gas alone, if there's too much gas in the tummy, it will look big, but when you touch it, you will look as if there is it's making all this drum like sound. So sometimes it could be water. So if there's water, a lot of water, what we call ascites, that could also make tummy to be swollen. All right. So there are many reasons why the tummy could be swollen. So if you think a child's tummy is swollen, number one, you have to see a doctor. Okay. The doctors, we can examine that tummy and we can figure out, is it water, is it hair, is it the organs inside that are swollen, So if we think it's any of the organs that is swollen, we can now do a scan to know which are exactly where the swelling is coming from, and then we can now, even too much feces, like children who are not passing stool, who are constipated, it can make the tummy to be big as well. So we can now know which one it is, and then we can deal with it. So the most important thing for you, number one, is sometimes people say tummy is swollen in children, but they are not actually, because some children at certain age, their tummy looks bigger than that of other, like 2-year-old. They tend, because of the curvature of the spine, they tend to have what we call protuberant abdomen, but there's actually nothing swollen there. But sometimes it could be swelling from the internal organs. So it could be gas, it could be water, it could be feces, it could be anything. So what you need to do, if you think your child's tummy is swollen, you have to see a doctor. It's not negotiable. Sometimes children can have tumors, they can have cancers, cancers of the kidney, like we call Wilms tumor, cancers of the what we call the adrenal gland nephroblastoma. There are so many things that can be swollen in that tummy. Normal swelling and abnormal swelling as well, even for the organs. So it's a very, very large very large possible issues that can be happening. So the most important thing is for you to come and see us, see the doctors. We have to palpate that tummy, we have to feel that tummy. And sometimes that is not enough, we may have to scan it. Sometimes that is not enough, we have to do a CT scan, we have to do images, and then we can tell you what exactly the swelling is, and then we can tell you what to do about it. So I hope that is helpful. All right, Larita Mel, thank you, God bless you too. All right, let's move on to Princess Sharon. We lost some parts of your question, but you said you did another test today, another lab for a follow-up. Bilirubin is 11.6, the red is 2.1. Anyway, I don't know the parts we missed out, but basically, if your baby's jaundice total level is not up to 12, it is still what we call physiological jaundice, and then we will not treat it. Okay, so we only treat jaundice level because your baby is already 2 weeks anyway. So if your baby was born on the 12th your baby was born on 12th of October. So today is 21. So your baby is how old? 9 days? Okay, 9 days old. Okay, so yeah. So your baby 9 days old, SB of 11.6, see physiological jaundice. I'm not going to do anything. I'm not going to treat your child. I'm not sure why your child was actually being treated in the first place. I have a feeling you are not seeing pediatricians, because pediatricians will know that what your baby has is physiological jaundice and there's no treatment. Your baby is not a preterm baby. Your baby was born at normal time. The weight of your baby is, normal weights. So there's no reason for this baby to be subjected to any treatment Antibiotics, physiotherapy, not necessary. All we need to do is to leave this baby alone and just monitor that the jaundice is coming down. And as long as it's coming down and it's not going above 12, there is no reason for us to treat the child. So it will just go on its own. So that's it. So, and it's only when your baby have jaundice beyond 2 weeks and it's above 12, and there are all, or your baby is sick in addition to the jaundice, your baby is sick, then that is when we'll begin to think of any cause of jaundice. Yeah. Okay. I've been Bola Jewel J Force. Say good day. Doctor, I'm polytraining my 2-year-old and it stays dry through the night. That is good. I would like to know if I need to wake him up to pee in the middle of the night. Why do you need to wake him up to pee if he's already dry? You don't need to wake up anybody to pee. If the child is dry during the night, just leave the baby alone. When baby wake up in the morning, baby will pee. There's no reason for you to do that. So don't look for trouble that is not there. Just leave the baby alone. You are lucky that your baby is actually dry through the night. Most babies are not dry at this time of the night, but it's okay as well. All right. How do you soothe a baby because of teething? How do you suit a baby? Is that one a pediatrician's question? I guess anything baby is pediatrician question. Okay, so is the baby bringing out teeth? Can you see signs that teeth are coming out? So that's number one. Then always tell me the age of the child. It's very, very important. So usually babies start to bring out teeth around 5 to 7 months. And so most of them bring out their teeth and there's nothing wrong. They are just fine. And that is number one. Number two, some babies will be feeling like biting other people, they bite you on your breast or the nipple because they want something to bite on. So you can give them all these what we call teethers, toys, soft toys that children can bite. So make sure you wash, you sterilize them. You can even put them in the fridge so it will be cool, so that when you bite on them, they have this cooling effect on the gums. And that is it helps to relieve them. So yeah, that's all you need to do. Most of the time, the teeth will come out and baby will be fine. They don't need any of the um, health issues. So there's nothing else to do beyond that. Okay, if your child is sick, if your child is having fever, any other illness, please don't say it's teething. Okay, you have to take the child to the hospital because a lot of people assume teething a lot. That's a favorite diagnosis of mothers, and it's not one of the pediatrician's diagnoses actually. Teething is just a normal thing for babies to do. It's just the same way they get up and walk, sit, or achieve neck control, the same way they grow bigger, the same way they bring out their teeth. It's a normal development. It shouldn't make them sick. It shouldn't cause any discomfort whatsoever for children. So if your child is ill, the child is irritable, the child is not eating, is refusing, don't let people tell you it's teething. You have to take that child to the hospital because most baby wake up and they have their teeth and nothing. You don't even notice until you see the teeth in their mouth. So that's the words is normal. But some babies may feel like biting, they may drool a little bit more. Then you can give them tita, something cool, soft, and something, that they can buy on so that it will give them that relief. Otherwise, there's nothing else to do. And teaching should not be a problem for children. All right. Okay. Um, Princess Sharon says, should I keep running tests? So, Sharon, I don't expect you to be the one running tests for your child. That is wrong. So, children should be under doctors, pediatricians, and we should be the ones telling you whether you should do a test or not. And so I expect your pediatrician to be seeing your child because sometimes people do test. We don't treat the test, we treat the child, not the test. So I need to see the child. I want to see, does the child look clinically jaundice? Does the child even look like there's jaundice at all before I will do tests? Usually, like I told you, if a child is having jaundice, we'll check. If we are not treating the child, we will just check in 48 hours, see whether that jaundice is coming down or not. So if it rises a bit, but it's not something worrisome. We may repeat it again in 48 hours to see. What we just want to see is that it's coming down and it's not going up. That's all. So, but then we're also looking at the child. We're looking whether the child is having clinical signs of jaundice. So sometimes the lab may give us a result. I'm like, no, this result does not look like this child, and we have to try a different lab, or get a second opinion. So that is why the doctor needs to see the child. We're also not just checking the child for jaundice, we're also checking that the child does not have any other symptoms. The child does not have anemia, the child is sucking well, the child is doing everything well. So it is not your responsibility as a mom to go and be doing tests or taking your children to do tests on your own. No, that's not right. We should stop doing that. I always don't encourage that for parents. So you have to go back to your doctors. They should be the one deciding. And when they do the test, because that's why many people will come and how I mean to interpret this wrong, that's also wrong. The doctor who asks for the test knows what he or she is looking for, and it's the same doctor that will now interpret. So whether the test is in line with what the doctor wants or not. So please, I will encourage you to see your doctors, and then they can do it. If you don't, I'm not sure whether I have confidence in your doctors. If they are not a if the doctor is not a pediatrician, I would recommend you see a doctor who is a pediatrician, because treating a baby with jaundice of 7, that is actually wrong. That we don't do that. So and give you unnecessary antibiotics. I don't know why. So, rather you make sure you are seeing a pediatrician who can manage your baby. Usually for newborn babies, not everybody can treat them. Not every doctor can treat newborn babies. Usually, preferably the pediatricians, we should be the one treating the child. So I will recommend that. All right. Okay. Let's move on. Piodun Shobola, good evening, doc. My baby can't sleep for 2 days. How old is your baby? Please start every question with the age of your child. It's so amazing how often I have to repeat that, but people don't just remember. Everybody is a baby, but it's not everybody is not a baby to the pediatrician. We always want to know the age, even if it's 1 day, even if it's 2 hours. I need to know. So always do that. We don't expect baby to be arcing their back. That sounds very unusual. Yeah. So there are some terminologies you use as a parent, and it immediately ring red flags and ringing bells in the head of a pediatrician. So arcing their back is definitely something I would like to see the child for. I want to be sure whether you are, sometimes parents use some terminologies in a way to you that it means something. Maybe that's not what it will mean to a pediatrician. So if your baby is crying and fussy and arcing the back, I'm not going to think colic. I want to see that baby. I want to be sure the baby does not have something going on in the brain. So I don't know whether it's just, and also you didn't tell us the age of the baby, so it's a little bit tricky now. So I need all those information first. So, but luckily this age is the age where you are going to hospital for immunization, you are going for this and that. So you may want them to have a look at the baby, okay? Babies can have colic. Colic is one of those things. Babies just cry for no reason, but you should be able to comfort them, and they should be able to soothe them. Yeah, they may not sleep in the night, but they will sleep during the day. So if your child is not sleeping at all, your child is hacking the back, you can't easily console the child. That is what we call irritable cry. When a child is very irritable, we are worried that there's something going on in the brain. So at that point, we as pediatricians, we want to see the child, and we just want to make sure that there's nothing else going on and all is well, because sometimes there are some neurological problems that babies can present with that way as well. So it's always good to just get a pediatrician opinion on that. But most likely, maybe it's just colleague and I'm the one who is being paranoid. But that statement you use about arcing the back just always trigger um, alarm flags, alarm bells in the head of pediatrician. All right, Shiyon Bade Islamia. Well done. What can you say my 6-year-old with ringworm? Tamono all over her head. I don't know. Okay, so ringworm, you have to come to the hospital. We have to see the child, and then we can treat. So ringworm is a fungal infection. Fungal infection requires antifungal medication. Antifungal medication to treat fungal infection, they are not we don't use them for 1 day or 3 days or 5 days. Sometimes we're treating them for 2 weeks, sometimes we're treating them for 6 weeks. So it's a long treatment. So it's not something just straightforward. And that's why many parents struggle, because they want to do it by themselves, and then the thing doesn't go away completely because you are not doing the whole treatment and all that. So I recommend that you see a doctor, preferably in a hospital, and then they can prescribe treatment, and then they can monitor the child. And it's not going to be easy for them to prescribe medication for you and just say you go and use that. There's a lot that goes into giving you medication. We need to be sure the person is not allergic to the medication. I need to be sure the child is not going to react to the medication. I need to tell you the side effects to watch out for. I need to tell you what to do when you see those side effects. So there are lots more information that goes into prescribing medication, because a lot of parents don't like it when you ask all this question, especially on Facebook group. And Dr. Boyede, what can I just use? And we said, no, we can't just tell you what you can use like that. We can't just prescribe. There's a lot more. I need to know the weight of your child to even know the dose that I'm going to give your child. So that is why it is not something we can do. And of course, when you go to pharmacy, they need to know that that medication is prescribed by a doctor who is taking responsibility for it. Okay, and so that is why we don't do that. I know many of you are not happy with that, but there are lots. Medications are very risky stuff. They are poisons. So when we give it, we need to control it, because the only difference between a poison and treatment in medication is the dose that we're giving. So that is why it has to be prescribed by a doctor. That is why you cannot just go and buy drugs. That is why when our neighbors and family just say, go and buy that, they are not helping, honestly. So and actually for children, I don't worry about adults anyway, but I worry about my children. So you have to see a doctor. They have to examine your child. They have to give you the right prescription, and then so you make sure, and then they can follow up as well to see whether it is working, it is not working, do we need to change and all that. So that is why it's not a easy thing to tell you just go and use that. I hope I've been able to explain that and you understand why we don't do that. So just see us in the hospital and we can write the right prescription. And sometimes we give not only by mouth, we also give, not only do you give a cream, we also have to give something by mouth as well. And sometimes when we're giving some of those medication, we are monitoring the liver function. We're doing a lot of other things along with it. So it's very important. All right. Precious Ophelia. My baby is 14 weeks old. She's fine. Thank God. No fever, no diarrhea. But she keeps scratching her gum. Okay, maybe just at the early phase of teething. And she always look forward to buy. Yeah, she's going to start bringing out the teeth soon. So I don't know whether you were here when I answered the question about the teethers or something. So just they must want to give her something she can bite on that is safe. So there are soft toys that are teethers. Some of them have this little water inside that you can put in the fridge so that it will get cold and they can bite on it. You can wash them, you can sterilize them, and you can give them again. So that's all you know. That's all you need to do, and that's perfectly normal behavior for this child. So Bjorn says she's uncomfortable when she farts. Your baby is 3 weeks old. 3 weeks old, yeah. Okay, so yeah, your baby most likely may have colic. Farting is normal. Babies get surprised when they are farting, when they are passing urine, when that's normal. It doesn't mean anything is wrong with child. So colic is when the child cries and cries for what look like no reason. They are well fed, they are not wet, they are not hungry, they are not cold, they are not hot and all that. They just cry in a healthy child for 2 hours sometimes, and then they can have that every day. So but it's a passing phase, and then it will go. Most of the time we don't need to do anything, just comfort the child, rock them. Some children rocking them work, some children white noises work, try whatever works. And then yeah, so that's normal. But I worry about that hacking of the bag. That's the one that worries me about your baby. You shouldn't be hacking the bag. I worry about that. Okay, yeah, 3 weeks is fine. Is the baby sucking well and all that? Just check all that too. Okay, my baby of 2+ and 4+, that is no information. Okay, when you say 2+, 4+, It's no information. It's 2 days, 2 weeks, 2 months, 2 years. I'm not going to guess. So you have to be very specific. Is it my 2-year-old, my 4-year-old, or my 2 months old? Because we see everybody, we see 2 hours old as well. So you have to always tell us the age in the appropriate units. So somebody is just telling me a baby is 3 weeks old. So if you just say 2 plus, how do I know that it's not 2 weeks plus or 2 months plus? Okay, so you need to tell us. So, but if your children are having cough and catarrh, most of the time they don't have fever, they don't have difficulty with breathing, they don't have fast breathing. You can just wait for it to go on its own. You don't need to do anything. It will run its course and go away. And but if there's fever, there's difficulty with breathing, there's fast breathing, those are the ones that you need to take to the hospital. So I hope that's helpful. All right. Judith OC. My baby was born at 35 weeks. Okay, twins. We're given routine drugs for 3 months. What? Okay, routine drugs, folic acid, iron. You didn't tell us. Anyway, and I've since stopped them because they are 6 months old now, not corrected age. You are not supposed to stop your medication. Your pediatrician who puts your child on the medication is the one supposed to stop it. Okay. So if you're, I hope you're seeing your pediatrician for follow-up. If not, you should. So there are many reasons why we do the the routine medication. You didn't tell me which medication your child is on, but if your baby were preterm, I'm assuming they are giving folic acid and iron. So we normally we will check for the PCV because we know that these children sometimes they are low in iron, being preterm, they are prone to what we call anemia of prematurity, and we're trying to kind of build up the blood ready. So we want to make sure all those are fine first before we stop the medication. So I'm not sure whether uh they are 6 months now, and that is even not corrected. So basically, they are still like 5 months, or less or thereabouts. So I would rather you ask your pediatrician first. Don't when we put your children on medication, please don't stop it until you ask us. I think your children should still be on those medication. Usually for preterm babies, if I put them on multivitamins, folic acid, I'm giving them definitely beyond 6 months. And so your babies are not yet 6 months if you correct for the age. So I will still want them to be on that medication. And most likely I want to check their PCV and all that. Make sure it's fine because now you're also going to start them on complementary feeds, and then breastfeeding is not is you're most likely not going to breastfeed as much as before. So we really, this is a phase, this is actually a period where they are prone to the iron deficiency and all that. So I would rather you leave them on those medication until you see your pediatrician and we've texted them that the PCB is fine, iron level is fine, and then we are happy for you to stop. But we are not in a hurry to stop for those. That's why we're giving it to them. We want to make sure that they have all those blood ingredients because that's actually what we're giving them: iron, folic acid. It helps the children to kind of build up their blood level for when they are ready to need it, when they need to start making their own blood. So I think you should put the children back and then see your pediatrician first before you do that. All right, let's move on. Holiday Kawonishe patience. Okay, my baby is 4 weeks old. He poo almost every time. Okay, when you say poo almost every time, how many times in 24 hours does your baby poo? That's the most important information we need because your information is just a little bit exaggerated. So it is okay for your baby to poo every time you feed them. And most time you will feed your baby maybe 8 times a day, be 12 times a day. So babies can actually poo 8 to 12 times a day normally. And that is actually fine. There's nothing wrong with that. So, but I just want to be sure that is what you are saying because you didn't really tell us specifically how many times. So, but we expect babies to poo between 8 to 12 times a day and normally, and the poo should be like yellow, soft yellow, like a goosey kind of stool. That is also normal. So, and there's no, just keep breastfeeding your baby exclusively. All right. Next question. I don't see any question on Instagram. Instagram people, let me know you are still there. If you have question, ask. Officer Dahiru, my baby is almost 4 years. My baby is almost 4 years. 3, 7 years. I'm not really sure what the question is. What the age of your baby is. Anyway, he had issue of fluid around the scrotum. Okay. Battery is running low. Let me put in my charger. Um, okay. Was drained out by pediatric doctor. So question is, does it reoccur again? I hope not. It shouldn't. Yeah. If your baby has what look like um hydrocele, I guess that's what you're saying. You didn't tell us when that was done. So if your baby had hydrocele when it was a baby, usually they have it in the first 1 year before the age of 1 year, and it has been drained. It should not happen again. Why do you think it should happen again? I don't think it should happen again. You don't need to worry about it. It should not. All right. Precious Ophelia is asking whether we have an office in Port Harcourt. Actually, we don't have a physical hospital office. We have presence in all of Nigeria because, like I said, we're a charity, we're a non-profit organization, and we do outreaches in all over the country. But we don't run hospitals, so we don't have like a hospital in Port Harcourt for you to see us. We normally recommend that you go to your own to hospitals around. If you are not sure which hospitals to go to, always go to the government hospitals. I know many of you always say complain. I know whenever I say, oh, maybe you should go to government hospital, people will come back and tell me all the horrible experience they have in government hospital. I'm so sorry. I wish it isn't like that. And I understand. I've worked in government hospitals all my life, so I understand what you're saying. Yeah, government hospitals may not be the most how will I put it now? The most friendly or the most um comfortable hospitals to be. But the only reason why I always recommend them is because you are going to see the best. All the best specialists tend to be in the government hospitals, especially the teaching hospitals. All the best specialists in your state or wherever location you are, you're likely going to find them in the teaching hospitals. So even though you may not enjoy the hospitality, the time wastage and everything, but at least you are going to be sure of one thing. You're going to be sure you're going to see the genuine doctors. You're not going to see fake doctors. You're going to likely see the best specialists in the teaching hospitals. So that is the only reason why I recommend them. But if you have a good private hospital that has specialists, as well, why not? You can go to them. But sometimes people are not sure in private hospital whether they are seeing the right doctors or not. So that is the only reason. I don't have any stake or I'm not a stakeholder in any of the teaching hospitals. Nobody is giving me any kickbacks, but I know that most of the best specialists in any country will always be in the teaching hospital. So that's why I say if you are not sure, you can always try the government hospital. Number one, government hospitals doctors are always vetted, so it's very very rare for a quack to be in a government hospital. Two, the specialists to be in our teaching hospitals. So that's just the only reason we do that. But some private hospitals have very good pediatricians. Just make sure you check, those people, check that people can validate them or ask them, about whether are you a pediatrician or not, and that kind of a thing. So yeah, sure. As long as you have a good doctor, you can always see them. But we don't run private hospitals in any of the cities. But we have our team doing our NGO work in each of the states of Nigeria. If you need more information about that, you can always send us a WhatsApp message. I'm sure our number is showing on the screen there. What I mean by hacking the back, that she will squeeze her tummy inside, squeeze her face to release gas. Yeah, squeezing is different. It's a completely different thing from hacking a back. So hacking a back means the child is going like a C. The child throws his heads backwards and like that, and then they come into a shape like a C. That is that's our own definition of hacking the back. The back turns into a shape like a C. It's a very serious sign of a neurological problem in children. So if your baby is just only wriggling and passing gas and behaving as if they're squeezing their body, that is not arcing the back, and that is definitely not something I worry about. So I just want to be sure we are all. That's why it's always important that we're on the same page. So that's why I always ask clarification. Sometimes I know parents ask questions, that's not what they meant, but it's good to clarify. Yes. Okay. Beatrice and Maddie. Good evening, dog. What can one do when baby have fever but cold feet? So, baby have fever, get a thermometer, measure the temperature. Normal temperature is 37.5 and lower. Okay. If your baby's temperature is less than 37.5, that is not fever. Okay, if it's above 37.5, that is fever. So if the feet are cold, you can wear socks for the feet. And then for the fever, you can remove, if you are wearing too much clothes for the child, you can remove it and wear just maybe a singlet, something light cotton. You can tap a sponge. That means tap a sponge means using normal water, normal temperature water, and like a towel, and you just dip the towel in the normal temperature, like tap water kind of level of temperature. You squeeze it out and just dab the child's body, leaving a little bit of water, because the way it's going to work, if you remember our science, is convection. So when the water is drying up, it's going to take some of the heat with it, and that will cool down the child. You can just give your paracetamol if you are the type that wants to quickly get to it. So give paracetamol, and make sure you always have paracetamol at home. That I think you should always have at home as a mother. Any mother, anytime see, you must always have paracetamol at home in your fridge. Okay, you must always have your digital thermometer. You must always have your ORS, the sachet. You must always have that at home, and oral sync. So those ones, basic first aid, you must always have them. It doesn't matter whether it's happening in the night, you have something to use. So those are the things you can do, and then you go. Then you can repeat it, keep checking the temperature. If it's coming down, fine. If it keeps happening, you can repeat your paracetamol every 6 hours. And if the fever persists, or if it is very high fever, anything 39 and above is high grade fever, you have to go to the hospital to know the cause of the fever. Okay, so that's what you do. All right, yeah. Judith will see the drug given are folic acid, Orofa, Bidec. Okay, so yes, I assume those are the ones that should be given. Please, you should still keep giving those drugs. Don't stop them. Don't stop them until your pediatrician asks you to stop them. That is the standard. And I think most time we give those drugs for a long time. Most time, I mean, we're still giving it for like a year. So just because sometimes we're checking at the same time, doing the full block and checking that everything is fine. So I won't recommend stopping it. Just give it. It's good for your children. All right, Princess Sharon, you're back. Okay, the pediatrician I took her to a government hospital Lutz when she ran the jaundice test on beach was complaining that my jaundice was so high. So I was afraid. She put under the blue light under 48 hours and were discharged without another blood test because she charged almost. That is not Lutz. So Lutz is not the government hospital that I'm not okay. You are saying the doctor you took the child to works at Lutz. Okay, so what was it? What was the SB? Because you have told me two SB, 7.3 and another one 11.6. Those levels are not high. Those levels are physiological jaundice. So I'm not sure which doctor you saw. So I can't comment about that, but I know that I'm only going by what you're telling me in terms of the levels. So you've not told me the levels in between, because the only one I saw earlier was the 7.3 level. Let me show you your first question. So you said you on the 12th of October, your baby was 3.3. Third day baby has jaundice. Took her to the pediatrician. She was 6 when she was 6 days old to run a test. Okay, and the level of 7.3 at 6 days is physiological jaundice. Okay, that is physiological jaundice. So that child should not have been put on phototherapy. That child should not have been given any antibiotics. I stand by that. So tell the pediatrician you saw that is what I said. Okay. So I don't know what there's, unless you have other figures, other values that you have not told me, but I'm going by what you wrote. So, and you can ask any other pediatrician. I mean, medicine is the same everywhere in the world. In the UK, in the US, in Nigeria, it's the same medicine we all practice. So there's nothing there. Again, this is why I also don't like people going to private hospitals. Okay, because some hospitals are not ethical and they just want to make money. Okay, and I know Nigeria is hard now, so everybody wants to make money. So I will not treat your child with an SB of 7.3. That is wrong. Okay, so I don't know what else, unless you have another value that your doctor picked up different from the value you are telling me. Is it 7.3 or is it 17? You didn't tell me it's 17.3. I'm looking at it again. So if I'm looking at it now, let me make sure I read it right. Okay, this is 7.3. Okay, so no, that is normal jaundice. The baby does not require any treatment. And even the one that you've told us that is 11.6 is still normal. At 9 days is still normal, and your baby still does not require any treatment. So sorry about your experience, but that is the truth. Okay, but if you want to have a second opinion, you can go to Lutz yourself. You can actually just go to Lutz and let them test your baby and tell you what to do. So at least you have a second opinion on that. So yeah, a lot of doctors say they do this, they do that. Doesn't mean anything. So as the fact that somebody work in Lutz does not mean the person is a. And now that anyway, let's leave it at that. Let me not go beyond that. Okay, so thank you so much. I think my time is up. But don't worry, princess. The most important thing that your baby is fine. Okay, your baby is sucking. Your baby is not having high jaundice. I'm okay with your baby, so if your baby is fine, don't need to worry yourself. Okay, I would say if this 11.6 is what you did today, and when your baby is 9 days old, in 48 hours you can go to the Lutz or anywhere else and let them repeat the jaundice level again. As long as it's coming down, if it's less than 11 again, that will be the last one. You don't need to repeat it again, and that will be fine. You don't need to worry. Okay, but I'm not worried about your baby's jaundice level. It's good. Don't worry about the money you've spent. The most important thing, your baby's fine. All right. Okay. All right. And when you're looking at your baby, don't worry about the money. Just focus on the baby. Okay. Don't worry. Thank you so much. If time is up, I have to go. But if you have any questions again, feel free to go to our Facebook group and then you can ask your questions. We are there Mondays to Saturdays, apart from Sundays. So Monday to Saturday, ask your questions. My colleagues, myself, will be there to answer your questions. And we'll be able to tell you also if you need to go to the hospital. Some of you come to our group and you've turned it to your second online hospital. We are not an online hospital. I'm sorry. Just like what Princess was saying, there are some things we need to do blood. Sometimes we need to do certain things. We can't do that online. So that's why we sometimes say you have to go to the hospital. Sometimes your children need prescription. When we are not going to write prescription for you online, we need to know the weights. We need to check this. We need to tell you it's a confidential consultation to do all that. So we don't do that online. Online is for advice, general advice, medical advice, but it's an advice that is valid, so you can, it's from a pediatrician, so you can take it to the bank or take it to the hospital. So that's the only difference. So feel free to ask your questions. We'll be able to do that. Okay, somebody's asking about ringworm again. Ringworm, you have to go to the hospital. The medication we use to treat ringworm is a prescription only medication. Nigerians, we need to recognize there are drugs you can buy by yourself from the pharmacy. You don't need a prescription. You can buy your paracetamol. You can even buy your anti-malaria. You can even buy your deworming tablets by yourself. You don't need us to write that for you. But there are some drugs you have to get a prescription. A doctor has to write it. So the drugs for treating ringworm is an antifungal medication. It's a prescription only medication. A doctor has to write it. And that doctor has to take responsibility for that. Antibiotics is a prescription only medication. A doctor has to write it. So please, let's remember that. All right. Beyond say, when will baby start to see? Baby can see from the day they were born. They can hear from the day they were born. They are hearing already and they are seeing already. And initially, we actually screen babies for hearing, newborn hearing screen. We should be doing that, but we're not doing it in Nigeria. But in countries like UK, they do it routinely. And baby can see Baby can see, don't worry, they can see your breast, and they can get up to the breast milk, so baby can see very well. All right, so if you have any questions again, please go to Facebook, Ask the Pediatrician Facebook group, post your questions there. Please be patient with us 24 hours. Some of you post questions in 2 hours, you already say, where? We've not answered my question. I am at work. I won't answer your question between 9 and 5 because I'm also working. I'm seeing patients that are coming to see me physically. So, but some questions are easy questions. So some of our moderators can answer them for you. But if it's a question that doctors have to answer, most of us do it when we are off work. So please be patient. And of course, if it's something urgent, you have to go to the hospital. You have to go to the hospital. And but if it's not something urgent, what do I do? What do I do? I want to know this. Something general, feel free to just post it and be patient, and we answer them for you. Okay. If you want to listen to all these topics, jaundice, pneumonia, we have already talked about them over and over again. So go to our YouTube channel. You can watch them. If you are the type that like to read instead, go to our website, www.askthepediatricians.com. If you are the like that love to listen, go to Ask Dr. Gbemi ATP podcast. All of them are there for you. Read, listen, learn, and share to others as well. But if you have, specific questions and all that, then put it on our Facebook group and we'll be able to answer them. Also on Thursday, we do our teachings on specific topics that has to do with health of children. So hopefully, I hope I'll be able to come online this Thursday. All right. Otherwise, I'll see you again next week, Monday, by God's grace, to answer your questions again, and then we'll take it up from there. So thank you so much, and have a wonderful, wonderful evening. Some people are still asking questions, but I have to go now. Just post any leftover question, post it on Facebook group. We will come and answer it from there. Have a wonderful evening, and it is bye bye from me. Bye.